Helicobacter pylori, H. pylori, infection, unraveling symptoms, causes, diagnosis, and treatment approaches. Helicobacter pylori, commonly referred to as H. pylori, is a bacterial species notorious for its affinity to infect the stomach, potentially leading to the development of sores and inflammation in the stomach lining or the upper segment of the small intestine, known as the duodenum. This infection, prevalent in about 2/3 of the global population, often remains asymptomatic for the majority. However, it stands as a primary culprit behind peptic ulcers, painful sores in the digestive tract, and can, in rare instances, progress to stomach cancer. Understanding H. pylori transmission. H. pylori transmission primarily occurs through interpersonal contact and various other vectors, including contaminated food, water, or utensils. The bacterium can also spread through intimate activities such as kissing and contact with infected bodily fluids, including saliva, poop, or vomit. Once introduced into the body, H. pylori proliferates within the stomach lining, compromising its integrity and rendering it more susceptible to the erosive effects of stomach acids, potentially leading to ulcer formation. Contagious nature of H. pylori. Indeed, H. pylori is contagious, with transmission facilitated through the exchange of saliva or other body fluids with an already infected individual. Factors predisposing to H. pylori. Factors predisposing to H. pylori infection. Helicobacter pylori, H. pylori, infection is influenced by a variety of factors, and understanding these predisposing elements is essential in developing strategies for prevention and early intervention. The acquisition of H. pylori typically occurs during childhood, but adults are susceptible as well. The risk factors associated with H. pylori infection are often intertwined with living conditions and various environmental aspects. Here, we delve into the key factors that contribute to the predisposition to H. pylori infection. Crowded living conditions. Overcrowded living environments, where individuals are in close proximity to each other, facilitate the transmission of H. pylori. The bacteria can spread easily in settings where people share living spaces, increasing the likelihood of exposure. Lack of clean water and sewer service. Inadequate access to clean water and sanitation services is a significant risk factor for H. pylori infection. Contaminated water sources can harbor the bacterium, leading to its ingestion and subsequent colonization in the digestive system. Close quarters with an infected individual. Living in close quarters with someone already infected with H. pylori increases the chances of transmission. Shared spaces and intimate contact provide opportunities for the bacteria to pass from one person to another. Living in a developing country. H. pylori infection rates are often higher in developing countries where sanitation infrastructure may be limited. Poor sanitation practices, coupled with crowded living conditions, contribute to the increased prevalence of the bacterium. Socioeconomic factors. Socioeconomic status can also play a role in H. pylori susceptibility. Individuals with limited access to healthcare and poor living conditions may face a higher risk of infection. Hygiene practices. Personal hygiene practices, including hand washing and overall cleanliness, are crucial in preventing H. pylori transmission. Poor hygiene can contribute to the spread of the bacterium through contaminated hands, utensils, or shared items. Educational level. Education levels may impact awareness of hygiene practices and healthcare-seeking behavior. Individuals with lower levels of education may be less informed about preventive measures, potentially increasing their susceptibility to H. pylori. Occupational exposures. Certain occupations that involve close contact with individuals, such as healthcare workers or those in the food service industry, may be at a higher risk due to increased exposure to potentially contaminated environments. Immune system function. The strength of the immune system can influence susceptibility to H. pylori. Individuals with compromised immune systems, whether due to medical conditions or medications, may be more prone to infection. Genetic factors. There is evidence suggesting a genetic predisposition to H. pylori infection. Some individuals may have a genetic susceptibility that makes them more prone to acquiring and harboring the bacterium. Symptoms of H. pylori infection. Helicobacter pylori, H. pylori, infection typically manifests with a range of symptoms, though a significant portion of those infected may remain asymptomatic. The emergence of symptoms is often associated with complications such as stomach inflammation, gastritis, or the development of peptic ulcers. Here are the key symptoms commonly associated with H. pylori infection. Abdominal pain. The most prevalent symptom is a dull or burning pain in the abdominal region. This discomfort may come and go, with its intensity fluctuating. Pain is often exacerbated when the stomach is empty and may improve after eating, drinking milk, or taking antacids. Bloating. Individuals with H. pylori infection may experience abdominal bloating, a sensation of fullness and discomfort due to the accumulation of gas in the digestive system. Burping. Excessive burping or belching can occur as a result of increased gas production in the stomach, contributing to abdominal discomfort. Loss of appetite. H. pylori infection may lead to a diminished appetite, with individuals experiencing a reduced desire to eat. This can contribute to weight loss over time. Nausea. Nausea is a common symptom, and individuals with H. pylori infection may feel queasy or have the urge to vomit. Vomiting. In some cases, vomiting may occur, particularly if the infection leads to complications such as peptic ulcers or severe gastritis. Weight loss for no clear reason. Unexplained weight loss is a concerning symptom and may occur in individuals with H. pylori infection, especially when accompanied by a decreased appetite. Changes in stool appearance. Most people infected with H. pylori will have normal-looking stool. However, dark, black, tarry, or bloody stools are alarming signs that necessitate immediate medical attention. It's important to note that while these symptoms are associated with H. pylori infection, they are not exclusive to this condition, and other gastrointestinal issues may present with similar manifestations. Additionally, a substantial number of individuals with H. pylori may not experience any noticeable symptoms. Emergency symptoms and indicators of complications. In severe cases or when complications arise, individuals with H. pylori infection may experience emergency symptoms, including bloody, dark red, or black stool. Gastrointestinal bleeding can result in the passage of dark or bloody stools, indicating a potentially serious complication. Trouble breathing. Difficulty breathing may occur if peptic ulcers bleed into the stomach or intestines, leading to respiratory distress. Dizziness or fainting. Severe bleeding or other complications may cause dizziness or fainting. Pale skin. Pale skin may be indicative of anemia resulting from gastrointestinal bleeding. Vomit that is bloody, black, or coffee ground-like. Vomiting material that resembles coffee grounds or is dark in color signals potential bleeding in the upper digestive tract. Serious, sharp stomach pain. Intense abdominal pain may be a sign of complications such as perforation or obstruction. Diagnosis of H. pylori infection. Diagnosing H. pylori infection involves a comprehensive assessment of symptoms, medical history, and may include a physical examination focusing on the abdominal region. Various tests are employed to confirm the presence of the bacterium, including stool tests for H. pylori antigens and PCR tests, which detect the bacterium and assess antibiotic resistance. The urea breath test measures carbon dioxide levels in breath, indicative of H. pylori activity. Additionally, upper gastrointestinal endoscopy, upper GI tests with barium contrast, and computed tomography, CT, scans contribute to a more detailed evaluation of the stomach and associated structures. Treatment modalities for H. pylori-induced ulcers. Effective management of ulcers resulting from H. pylori infection typically involves a combination of antibiotics and proton pump inhibitors, PPIs. Triple therapy, integrating PPIs with 2 antibiotics, represents the frontline approach. Antibiotics such as amoxicillin, clarithromycin, metronidazole, tetracycline, or tinidazole may be prescribed. PPIs, including esomeprazole, lansoprazole, omeprazole, pantoprazole, and rabeprazole, are crucial for reducing stomach acid production. Bismuth subsalicylate and histamine, H2, blockers like cimetidine and nizatidine may complement the therapeutic regimen when necessary. Common triple therapy approaches. 2 prevalent 3 medication treatments include rifabutin-based triple therapy and clarithromycin triple therapy. The former involves a combination of amoxicillin, rifabutin, and omeprazole administered every 8 hours for 14 days, available as a single pill known as Talicia. Clarithromycin triple therapy combines clarithromycin with either amoxicillin or metronidazole, along with a PPI. Particularly useful when H. pylori exhibits low clarithromycin resistance. Monitoring and follow-up. Regular monitoring for treatment effectiveness involves retesting for H. pylori approximately 4 weeks post-treatment completion. If signs of persistent infection persist, an alternative antibiotic regimen may be considered. Notably, abstaining from nonsteroidal anti-inflammatory drugs, NSAIDs, during the recovery period is crucial to prevent further damage to the healing stomach lining. Complications and long-term risks. H. pylori infection commonly results in gastritis, causing irritation, swelling, and potential discomfort. The most frequent complication is the development of peptic ulcers, affecting about 10% of H. pylori infected individuals, with severe cases leading to blockage, perforation, or bleeding. Although uncommon, untreated long-term H. pylori infection elevates the risk of certain stomach cancers. Early signs include subtle symptoms like heartburn, progressing to abdominal pain, nausea, reduced appetite, persistent fullness after minimal food intake, vomiting, and unexplained weight loss. Vigilance for these indications is paramount, warranting immediate medical attention. Preventive measures against H. pylori infection. Preventive strategies align with general hygiene practices to curb the spread of infectious agents. Emphasizing hand hygiene, especially post-bathroom use and before food preparation, stands as a primary preventive measure. Adhering to clean eating and drinking practices, avoiding undercooked food, and steering clear of items handled by individuals with inadequate hand hygiene contribute significantly to infection prevention. Role of diet in H. pylori susceptibility. While sanitation and hygiene are prominent risk factors, emerging research suggests a potential link between diet and H. pylori susceptibility. Studies indicate that diets rich in fresh fruits, vegetables, whole grains, nuts, and seeds correlate with lower H. pylori infection risks. Conversely, diets abundant in carbohydrates, processed grains and meats, sugars, and salt exhibit a predisposition to H. pylori infections. The protective role of compounds like vitamin C, polyphenols, and flavonoids in the former group's diet is postulated, although further research is warranted for definitive conclusions. Frequently asked questions, FAQ, about Helicobacter pylori, H. pylori, infection. What is Helicobacter pylori, H. pylori? H. pylori is a type of bacteria that can infect the stomach, leading to conditions such as gastritis and peptic ulcers. In some cases, it can also contribute to the development of stomach cancer. How is H. pylori transmitted? H. pylori is primarily transmitted through interpersonal contact and exposure to contaminated sources, including food, water, utensils, and intimate activities like kissing. The bacterium can also spread through infected bodily fluids such as saliva, poop, or vomit. Is H. pylori contagious? Yes, H. pylori is contagious. It can be transmitted through the exchange of saliva or other body fluids with an infected individual. What are the symptoms of H. pylori infection? Common symptoms include abdominal pain, bloating, burping, loss of appetite, nausea, vomiting, and unexplained weight loss. However, a significant number of individuals may remain asymptomatic. What factors predispose someone to H. pylori infection? Predisposing factors include crowded living conditions, lack of clean water and sewer service, close contact with an infected individual, living in a developing country, socioeconomic factors, poor hygiene practices, lower educational levels, certain occupations, compromised immune system, and genetic factors. How is H. pylori infection diagnosed? Diagnosis involves a combination of assessing symptoms, medical history, and various tests. Stool tests, PCR tests, urea breath tests, upper gastrointestinal endoscopy, upper GI tests with barium contrast, and CT scans are employed to confirm the presence of H. pylori. What is the treatment for H. pylori-induced ulcers? The standard treatment involves a combination of antibiotics and proton pump inhibitors, PPIs. Triple therapy, which includes a PPI and 2 antibiotics, is commonly prescribed. Antibiotics may include amoxicillin, clarithromycin, metronidazole, tetracycline, or tinidazole. PPIs reduce stomach acid production. What are the common triple therapy approaches? 2 common types include rifabutin-based triple therapy, amoxicillin, rifabutin, and omeprazole, and clarithromycin triple therapy, clarithromycin, amoxicillin or metronidazole, and a PPI. These are administered for a specified duration. How is treatment effectiveness monitored? Individuals are typically retested for H. pylori about 4 weeks after completing treatment. If signs of persistent infection are observed, an alternative antibiotic regimen may be considered. What are the complications and long-term risks of H. pylori infection? Complications include gastritis, peptic ulcers, and, rarely, an increased risk of certain stomach cancers. Emergency symptoms such as bloody stool, trouble breathing, dizziness, pale skin, and serious stomach pain may indicate complications. Conclusion. In conclusion, Helicobacter pylori, H. pylori, infection is a multifaceted health concern with widespread implications, affecting a significant portion of the global population. This bacterial species, notorious for its affinity to infect the stomach, can lead to various gastrointestinal issues, ranging from asymptomatic conditions to severe complications like peptic ulcers and, in rare cases, stomach cancer. The transmission of H. pylori is facilitated through interpersonal contact and exposure to contaminated sources, emphasizing the importance of hygiene and sanitation in preventing its spread. Factors predisposing individuals to H. pylori infection are diverse and include living conditions, access to clean water, close contact with infected individuals, socioeconomic status, hygiene practices, educational levels, occupational exposures, immune system function, and genetic factors. Recognizing the symptoms of H. pylori infection, such as abdominal pain, bloating, and changes in appetite, is crucial for early intervention. Diagnosis involves a comprehensive assessment, including various tests to confirm the presence of the bacterium. The standard treatment for H. pylori-induced ulcers involves a combination of antibiotics and proton pump inhibitors, administered through triple therapy approaches. Monitoring and follow-up after treatment are essential to ensure its effectiveness, and vigilance for complications and long-term risks is paramount. Complications, such as peptic ulcers and an increased risk of certain stomach cancers, highlight the significance of timely and appropriate management. Preventive measures, including good hygiene practices and a potential link between diet and susceptibility, play a crucial role in controlling H. pylori infections. While research on the interplay of diet and susceptibility is ongoing, current evidence suggests that diets rich in fresh fruits, vegetables, whole grains, nuts, and seeds may contribute to lower infection risks. In essence, a comprehensive understanding of H. pylori infection, from its transmission and symptoms to diagnosis, treatment, and preventive strategies, is essential for effective management and the reduction of associated risks. Continued research and awareness efforts are critical in further unraveling the complexities of this infection and improving preventive and therapeutic approaches. Your health matters. Quali.health